Doctors with UT Health and the Dell Medical School are urging more pregnant COVID-19 patients and their doctors to consider monoclonal antibody therapy.
The CDC is also recommending that treatment. KXAN's Tahara Rahman reports that's because pregnant women are more at risk of developing severe illness up to 42 days after giving birth.
We definitely did not plan to start a family.
Caitlin Bailey and her partner also didn't plan to start during a pandemic.
My mom was sad. She didn't get to go to the hospital or anything like that.
The family of three got COVID-19 2 months after Emery was born. Now pregnant with her second child, they're still holding off on getting vaccinated.
We want to wait till there's a little more research out there on it.
It's a sentiment doctors are still trying to fight, including Allison Cahill at UT Health Austin's Women's Health Institute.
We worry a lot about what we don't know. But there are things that we do know also in this space.
The CDC says pregnant women are more likely to contract severe COVID-19 illness compared to those who aren't pregnant.
The truth is that what we're seeing is that the disease itself is doing horrible things to moms and their unborn kids.
Cahill is also a professor at Dell Medical School. They're recommending pregnant COVID-19 patients also get monoclonal antibody therapy within the first 10 days of symptoms. With a doctor's referral, it's free at the Regional Infusion Center inside the Travis County Expo Center.
I think with each individual patient, based on their risk of developing severe COVID, it's a discussion with the patient and the doctor about what's best in that scenario.
You like it?
Bailey says she's open to the therapy as she heads into her second pandemic pregnancy.
Definitely helps knowing that I have an option.
Tahira Rahman, KXAN News.
Health leaders still say even with antibody treatment options, getting vaccinated is the best way to prevent a severe illness from COVID. Last week, the CDC reported a rise in the number of pregnant women infected with the virus, and they also said data from nearly 2,500 pregnant women who got that vaccine before 20 weeks did not face any increased risk of miscarriage.
According to the CDC, the chance of a baby born testing positive for COVID-19 is extremely low, even if the mother is infected. The agency has data on more than 3,600 newborns. Over 3,300 were born testing negative when their mothers were sick. Only 220 were positive. The CDC says it does not know if these babies got the virus before, during, or after their birth. The agency also reports that most babies who tested positive had mild or no symptoms and they recovered. However, reports say some newborns develop severe COVID-19 illness.